Epilepsy isn't just a medical term, it's a neurological disorder that affects millions globally. It is caused by repeated seizures due to abnormal electrical signals in the brain. These signals disrupt brain's normal rhythm, leading to sudden and unprecedented episodes. Anyone, regardless of age, gender, or region, can develop epilepsy. And for pharmacists preparing for OPRA examination, it is very crucial to understand this condition. So let's break it down. The very first question that strikes our mind is why epilepsy happens? What are the causes behind epilepsy? There could be many causes. That includes genetic mutation, brain injury, infection like magnetitis, or metabolism disorder. But in nearly half of the cases, the main cause remains unknown. There are two main types of seizure. First one is focal onset seizure. This one appears in one part of the brain and may cause sensory changes and impaired awareness. And the second one, generalized onset seizures. It impacts both sides of the brain, like absence seizures in children and tonic-clonic seizures that involves stiffening and jerking. Diagnosis involves EEG to detect abnormal brain waves, MRI to spot structural issues, and blood test to rule out metabolic causes. Treatments include anti-epileptic drugs like phenytoin, valproate, and lamotrigine. And for drug-resistant cases, surgery or lifestyle changes can help. That includes sleep hygiene and stress management. Adjunct therapies like ketogenic diet and vagus nerve stimulation are also used. And here, pharmacists can also play a vital role in prescription, adjusting drug interaction, and patient counseling. If you're preparing for OPRA examination, epilepsy is one of the highly ill topics that includes neuropharmacology, clinical pharmacy, and patient counseling. Mastering it means you are not just exam ready, but you are patient ready as well. Found this video helpful? Like this video, share this video, and if you wish to know more about OPRA examination, comment OPRA in the comment section and our team at Elite Expertise will reach out to you. Subscribe to Elite Expertise for more such updates, and yes, don't forget to hit that bell icon.